on the bike. Everybody loves the bike. Okay, we're gonna do 25 count, and it starts when you start.
All right, on the record, everybody, this is Payback. Des is trying to get me back.
Literally.
She's trying to kill me.
So for those who don't know, I have suffered a very traumatic injury, and one of the first things that I did was I saw Dr. Shannon Hatfield here.
That's me.
You know, I don't know. When I would go into these sessions, what my original thought is, okay, cool. So I'm going to go in there feeling good or ish, and then I'm going to go out leaving feeling better, right? No. You just had to make sure that I would just like absolutely hate my life, basically. Yeah, but I mean, it was needed.
Thank you.
Yeah, you're welcome. Where are you even going? You're on 4 cows. Wow, look at you.
Oh my gosh, that's it?
Elbows in, chest up. I'm going to get to your band.
Yeah, I haven't done these in forever. Everyone, bear with me on this workout.
So Shannon.
That's me.
Tell us who you are and what you do, other than torture me.
All right, world. I am Shannon, aka Dr. Shannon Hatfield Chiropractic. I'm a sports chiropractor out of Los Alamitos. I'm dying right now, by the way. We're 2 minutes in. I forgot what else.
Who do you specialize in?
Okay, so I specialize in all of the above. I am a sports chiropractor, but that doesn't mean that I work on anyone and everyone. Whether it's car accident cases, professional athletes, anywhere from 5 years old. I think right now my oldest patient is 90, so I don't turn away anyone.
And you truly are the best.
Thank you.
No, I think I'll tell you how great you are, but you have more.
Where are we at?
It's right there. It says 15. You see it? It says 15?
Oh,
give 10 more. No, but everybody I have ever sent to you always says the same thing. How good they felt by going to see you. Amazing.
Honestly, I appreciate that. I think you and Ryan, actually, funny story. When I met Ryan over here, he heard I was a chiropractor and he was, oh no. Absolutely not. I don't believe in chiropractors. And I was like, okay, come see me.
It's astronomy or something.
He's like, a Libra? No. And he's like, hey, come see me, right? Let me work on you. If you don't, then whatever. But if you do, call all your friends. And Ryan, he liked it. He believed in me.
Right?
You better point that out, that baby. All right.
Yay. 25 cows. Okay, cool. So let's do some dynamic stuff. Let's go hamstrings. So good mornings, hamstrings. A little bit. Let's do 15 of those.
She's trying to kill me, everyone.
Yeah. Well, you're also moving at the speed of light right now. So wait, I remember you telling me a while back that you actually went to medical school for a little bit, or you wanted to go to medical school. What made you pivot?
So yeah, I think initially when I started working at a hospital, I did a clinical rotation.
Your knees don't touch the ground.
All right, here. I just realized like I was there for a couple years, rotating every floor in the hospital. And I'm like,
years?
Yeah.
Oh, wow.
I was trying to get it basically for it to look good on like my application. And I realized this is not the life I wanted to go. Kind of want to work with people that wanted to get better. You know what I mean?
Yeah.
So yeah, that kind of what brought me to chiropractic.
What was your thought of making that pivot?
I just feel working in a hospital is depressing and
oh, sure.
You know, outpatient work, chiropractic, even physical therapy, you're working with people most of the time that want to get better.
Yeah.
And that's kind of why I chose that. And also being able to help people with my hands and knowledge to get better.
Yeah.
And movement is a game changer to me.
Back into the surrenders. For sure. I agree with that. I mean, you know, we work on the personal training side, the coaching side, but movement totally is medicine, and being able to have that holistic approach, you know, rather than just being, here's a shot and send you on your way.
Yeah, exactly.
You know, and I think that's what everyone appreciates when I send them to. It's not just creating a plan for them and how to get better. This is the game plan. This is the approach that we're going to take. And a lot of people point that out when they come back from you.
Honestly, there's a time and place for everything. You know what I mean?
Put those on your computer. This.
Oh, on top.
Yeah.
There's a time and place for everything. Surgery, cortisone, epidurals, all that.
Sure.
Most importantly is moving.
Hinge forward. You go out, in, 1, out, in, 2, out, in, 3, all the way to 10. And then when you get to 10, you're going to stand straight up and you're going to drive your knees to your chest. March.
Okay.
March, 10. You're going to do that 3 times.
Oh my gosh. All right. Disclaimer. I played soccer and I'm already so sore. And I told Des, hey, Ryan, don't look at me like that. I was, hey, go easy on me, baby.
And before even saying hello, I played soccer. Go easy on me.
I knew she was going to kill me though, because in my office, she's like, I hate you. Look, I'm just trying to get you better.
This is going to be fun. This is how we.
Oh, my glutes. They're burning. Ryan's over here laughing at me.
So tell everyone how you recently opened up your own space after being under others for a while, right?
So wait, so I'm up?
Huh?
I'm
yes.
up. Okay.
Yeah. So marching.
All right. So
keep your body as still as possible.
I actually went out on my own 2 months after graduating school. What happened was I started renting space from a chiropractor here in Los Al, and I got the offer to be in my own office. And at first I wasn't super busy, so I didn't know how I was going to manage, but I kind of just went out on my own, went to a bunch of different businesses in Los Al, handed my business card, started working with gym owners and kind of getting my name out that.
I'm only laughing because I have to play this new game with Shannon. It's called Where is Shannon? You know, if you go to any business out in Los Al or even Seal Beach, kind of, you see your car. I'm just getting coffee and I look down, I go, oh, Hatfield, right? Or I went and said, oh, look, there's Hatfield. Where's Shannon out in the world?
I did that when I first started because truthfully, I think I needed to introduce myself to people and talk to everyone in the community and just show them what I do. And then after that, it was referrals, just people believing in me and sending me other people. Social media blew me up. And yeah, Los Al's great though. It's such a good place to be in.
I don't think you're giving yourself enough credit because you make it sound, you were so vigilant about it. You hustled, and that is how you're getting to with your knowledge, the way you provide, and how hard you hustle. You know, what I mentioned one business, you know, at your office, and you're, oh, I'm going to go there tomorrow.
Yeah.
You know? So you still do it. You do it a lot. It's so cool.
I think we're in a male-dominated profession. I am, at least. And so kind of leaning into that and making room for other women in the profession, especially sports chiropractic, it's been on the upswing. But, you know, a lot of people are used to the old crack and send, and that's just not how I am or a lot of my colleagues.
You hear it a lot. And I'm sure that's, you know, that was one of my questions I was going to ask you is what's the biggest in sports chiropractic? There we go. Coffees. Sports chiropractic. What is the biggest misconception, which would be?
Yeah, honestly, I would say anyone hears the word chiropractic and they just think it's just a crack and send, you know, and that's going to fix everything. Also, too, they hear sports chiropractic and they think we only work on athletes. And the truth is, and anyone that moves is an athlete to me. But yeah, no, I don't just adjust somebody and send them on their way. And usually when people come to me and they want that quick fix, that's not me.
People ask that all the time. Every time, you know, they come in, they're saying, oh, my shoulder hurts really bad. And well, no, it's more than that.
Yeah.
It's more than that.
I'm like, hey, I don't want to be adjusted or I don't feel comfortable. Then I don't adjust them. Because it's more than that.
Yeah.
It's the muscle, it's mobility.
Yeah.
It's stability.
Yeah.
And yeah, it's more than an adjustment.
I feel like you've just been dancing for 20 years at this point.
Oh, I thought you meant right now.
Yes, that's what
I need more coffee.
I feel. Ryan is trying to stay so still right now.
I know. He's so excited I'm here, everyone.
Finish up this. This will be it.
Are we done? All right, cool. Whew. Over these damn bands.
You can pause it. Well, 4x5 is really not that much. And I think you can do this fairly easy. So 5 reps, rest for 30 to 45 seconds. Yes.
What?
Ooh, that's actually a good idea.
Out of this.
We'll do that.
Holy fucker.
I'll give you a blue one.
All right.
It's called applied application. So
You know what I should start doing? I should start posting the actual workouts underneath.
Yeah, why don't you?
I don't know. I'm just learning as I go.
All right, so I'm doing...
So you're doing 4x5. Fuck yeah, I am. 4x4. I'm legit tripping over my words so bad today. Okay, and I'm gonna be nice. I'm just gonna give you 4x10 with the kettlebell swings.
Okay, wait. So 4 sets of 10 supersetting?
So you're doing 4 sets of 5 supersetting with the 10 kettlebells. Yes.
Okay, so 5, 10.
5 and 10. And I will say it's time to go again. Okay. And I expect you to answer questions in the middle of all of it.
All right, are we going?
Whenever you're ready, doctor. Squeeze your back. Wow. Okay, one. Are you kidding me? All the way down. Down, down, down. There you go. Sit down with your butt. Cool. Very good. So if you could think of one moment that reminded you as to why you do what you do, what would be that moment? Hinge, hinge, hinge. There you go.
One moment. I mean, honestly, there's not just one moment. I would say there is a ton. Just getting people out of pain, to be honest.
Yeah. Is there one that sticks out in your head? Recent months that you're just like, heck yeah, I did that.
Yeah, I think there was one lady that came to me that had been in pain. She's been in shoulder pain for years and no one was able to help her out. And probably after 4 sessions, I got her out of pain.
Oh my gosh.
Full range of motion. And I think knowing that she had gone to so many other practitioners and she was still having pain, and then coming to me and being able to help someone like that just made me feel good, you know?
Yeah. That's awesome.
I would say, I mean, there's so many other stories from, you know, just helping high level athletes to
back at it
to anyone, just, you know, weekend warriors, you know, desk jobs. Yeah.
I feel like a lot of people don't realize how much they need to seek help before a problem arises. Wouldn't you agree?
Yeah.
I mean, I think you and I've had this conversation quite a bit of times, you know, because we refer people to you and then they disappear after they're out of pain.
Yeah.
They don't think they need the maintenance. So
a lot of people work through pain, and pain is a signal to figure it out and get to the root problem. You know, sometimes stretching and all, sometimes it's loading the tissue, mobility, rather than just lifting and working through pain.
Yeah.
You know, especially shoulder pain, I get it a lot.
Yeah.
People just keep hitting overhead, and, you know, and they come to me when it's torn or severely strained or has been impinged for years.
That's crazy. Or they're just several months. And people don't realize that any kind of headache is not normal.
Yes.
At all.
Correct.
At all. So, oh yeah, this has always been a problem for me, but she never said anything.
Yeah.
It was, you know, lower back issues, I think it was. And she's like, oh yeah, my back always hurts.
Yeah, that's not normal. No, pain is not normal, everyone. Headaches, pain, all of that. There's obviously a root cause, and we got to get to that rather than just treating the symptom. Let's figure out why.
Sure. Yeah, no, I remember just being so flabbergasted. I was like, dude, back squats and feeling pain at the bottom, and then step ups, and then any kind of hinge movement. Oh yeah, it just always hurts. Girl.
Yeah, not normal.
And then doesn't say anything about it until it's too late.
Until they're crawling in here.
You know, until they're canceling. They're canceling their sessions. It's I can't get out of bed. Well, why can't you get out of bed? My back hurts. Well, how long has your back been hurting? Years. What?
Yeah, you're not.
What do you mean years? We train 2 times a week. Okay, so break one more. Yeah, dude, I can't. I mean, this is a good question too, actually, because it's kind of on the same subject. How do you balance keeping someone out of pain while pushing performance?
Keeping someone out of pain while pushing performance. I would say progressing them slowly and working where they are rather than just speeding them up where you think they should be.
Yeah.
Is just meeting them at their level and slowly progressing instead of just loading. I think there's a fine line between stability and mobility. Yeah, I think stability, honestly, is more important.
Oh, sure.
Building that, like stabilizing the joints, right? And then also mobilizing, they kind of go hand in hand.
Yeah. I think it's kind of hard for me to ask these questions because I know we do that a lot here, but you get a lot of people who come in from bad coaching, from bad gyms.
Yes.
Who are just, you know, I had this coach and I told him I had this really bad shoulder pain. Yeah. And I told him I can push this much weight. He said, do it anyway.
Yeah.
And now I can't even lift my hand up this high.
Yeah, I get that a lot. I do, honestly.
Not here though. No.
Here. What's funny is actually, you know, I've had to rehab a couple people from trainers that just, they don't know how to pivot. So if somebody's in pain, they're just, yeah, you're fine. Or let me go less, you know, rather than switching the exercise or helping them get mobility or something like that.
Taking a step back.
Yeah, exactly. So I get that. Okay, we're ready. But yeah, that happens often.
What are some signs that you would tell people to look out for as far as gyms and coaching? If you were in that situation.
Gyms and coaching, red flag.
High red flag.
Okay, I think coaches and trainers that think that they know everything, when in reality, there's so much more to. I think that's a huge red flag. Yeah, personally, I like to work with trainers, you know, to help the patient. So if any of my patients work with trainers, these two work together, tell me what's causing their pain, or, you know, whatever it may be, and let's figure it out as a
you're really good at that. Hey, I just saw so and so. These are my recommendations. These are what you should go forward with. And, you know, I don't think every coach and every trainer and every gym is lucky enough to have a good provider like you. But I do agree with the fact that, you know, if you get a coach who just, I already know that. Oh, yeah.
Knows that I'll work with Ryan and Des and to help them get better, to help them excel at what they're doing. And you know what I mean? So what's up, Black Box?
Let's go. One more. Last one.
Let's get it.
Last one. Okay, so I'm just saying 115 obviously was super light for you.
I know. Honestly, I went a little light.
Don't worry, we have so much more to do. There's so much more for us to know. And that wraps up our body's business and biomechanics section.
Hallelujah.
Next. And you just finished that too.
Rear elevated foot.
Okay, 15 pounds. Okay, so you have 8 and 8. 8 on one leg, 8 on the other leg. I want your chest to be nice and high. We're working abs today.
Getting me back.
And then we're going to do 10 heel elevated split squats. What? Oh, you can move your week. This is where I stand. This is forever the battle.
All right, so
Slow speed racers, slow down.
all my patients watching this are probably laughing.
Yeah.
Because this is the stuff that I make them do.
Stand all the way up.
And I tell them to slow it down.
Come all the way up, all the way down, all the way up, all the way down. I'm going to give you another 15. That is, what? You are crazy. That is so easy for you.
This is so hard, everyone.
This is literally not hard at all. Chest up, all the way down, all the way up. Do you see that quad? It should be activated.
These are baby quads, everyone.
That played soccer.
Yeah.
What's one injury you love helping people come back from?
Shoulders, shoulder dysfunction.
Shoulder dysfunction.
Yeah, so labral tears, impingement, rotator cuff strains, any kind of shoulder dysfunction. Yep.
Where have you been seeing it the most lately? Like, where have you seen it come from the most? There you go.
Honestly, just over time.
At the bottom? Yeah, I hate it.
She hates my form.
I hate everything about it. Pause, up, down, pause, up. Drop below.
Work on my dance.
Okay, anyway, so where have you been seeing shoulder injuries the most as of lately?
Honestly, I would say people that are kind of sedentary and then they go back into lifting weights and all that tightness, they're just blowing past overhead exercises and whatnot. Am I supposed to look there or here?
You can look here or there.
Okay.
But let's look here.
Got it. What else? Yeah, I have no idea what we're...
Sedentary.
Yes, sedentary. It's like
answer my question. Do it right. Stop bouncing. Stand all the way up. Go all the way down. Tell me about your weekend.
Heart. Yeah, shoulders all the way.
Is it more of an actual rotation or is it just kind of similar in mechanics?
As far as injuries?
Yeah.
I would say probably overhead. All the overhead athletes, anyone that hits, Arnold presses a lot. I see it a lot with that because most of the time the shoulders are super tight and then thinking that they have the range of motion, they're just, still fighting through it and then adding weight to it.
Oh, yeah.
And that's the issue.
Yeah.
Rather than addressing the mobility, you know what I mean? And then loading the tissue.
Yeah. Well, I know this is kind of a pivot sort of, but you've been working with football players a lot lately.
Yes, I have.
What do you see a lot in them?
Let's see, football players, anywhere from hamstring strains to ankle instability to shoulders, I would say.
Yeah.
That's the biggest ones right there.
Yeah. And where can you, what is La Salle, or this whole area in general is big on football and baseball, right? What would you give your biggest piece of advice to them to prevent those things? Especially playing such high impact sport like football and a high injury rate sport like baseball.
Honestly, I would say plug in with, a professional, a coach, a trainer, something like that to work on stabilizing the ankles, the shoulder, wrist, elbow. That would probably be the biggest advice from me because I see them after the fact.
Yeah.
When they're injured and they're coming to me, basically, hurry up, get me better. I need to get back in the game.
Yeah.
And so that's what
Does that make it worse or? Especially if they're going to hurry up, I need to get there because I don't want to miss
Yes and
this.
no. They'll have shoulder tears, labral tears in their hip, and they're still getting back in there.
Oh my gosh.
And we need to step back a little bit to spring you forward. You know what I mean?
For sure.
But with athletes, that's the name of the game. It's how quick can you get me back in?
Yeah.
It's actually professional,
I'm seriously, take your time. What was the first?
Literally.
Probably a year.
She said that she's telling me this, mind you, everyone, probably a week after she tore
my ACL.
Her ACL.
Yeah.
No, well before surgery.
My biggest thing was I wanted to get back to volleyball. And now, even though I have people, you and Becca, telling me otherwise, I don't think it's worth going back to volleyball, but I do want to run.
Yes.
I do want to get back to running.
But you will.
I know. Soon.
You'll be running a Long Beach half marathon with me.
I know. We did say that's in October. We did say if I sign up for it, then that's
it. It's a wrap.
Maybe I'll just walk it. Maybe I'll bring one of those knee scooters.
I'll push you. Can you imagine
Can you
that?
imagine this Dr. Shannon Hatfield push his friend across Long Beach half marathon line
in the freaking scooter?
And you're like,
5 hours later.
Oh, God. Okay, this is a good question. What's more satisfying, getting someone back to a sport or watching them PR after rehab?
I would say both for different reasons. I think having them PR is knowing that whatever we're doing is right. The strength, the mobility, stability. So I think that's cool. And then getting them back into sports. I'm a sports nerd. So that's also a win for me.
Yeah.
So both in different ways.
Yeah.
For sure.
That's cool. I appreciate that answer. And you're done with this.
High five. Oh, wait. Look at my elbow. We'll never miss.
Okay. So she is doing 3 rounds of 5 cows on the air bike, and then you're gonna jump off, and we're gonna do a max wall sit with your 20-pound medicine ball. And I expect you to be at 90 degrees and driving into the wall, and that ball needs to be squeezing your leg.
She sounds like,
I can't wait for your workout. So this is
I see you.
20 pounds, and it's until you cannot go any longer. And if you lie to me, I'm just gonna put you right back on the wall and say it's time. And this is meant to be a little bit faster.
Wait till you come into my office next.
Every time a little tear comes out of my eyes.
Start.
All right, starting? Cool.
Yep, let's go.
Faster than that. Nice try. It's
Oh,
5
the
cows.
fan feels great.
Okay, so rapid fire round of questions.
Wait a second. Okay. Damn,
Oh,
I'm
wait.
only
Mobility or stability?
stability.
Glute activation or scap retraction?
Glute activation for any low back, knee, ankle, foot pain. Scap retract for cervical, actually the neck, elbow, wrist. Yeah.
Wow. Amazing. Neuro or manual therapy?
Manual therapy for mobility, art neuro for stabilizing and loading.
Okay, is that 5 cows? What do you want, 7? Get your ass on the wall. All right, I'm going to do all the things you said to do.
20?
You gave me 20 every single time.
I gave you 15.
Did you really?
How rude, everybody.
Well, today we're doing more because you're strong and you have 2 good knees.
All right, wait,
We're going to hold that as long as you can. I'm going to do this. And drive into the wall.
Yeah.
Harder to rehab, knees or shoulders?
Shoulders.
Why?
Hypermobile joint. Complicated.
Love it. Medically terms. Keep going.
Oh, sorry.
Bigger headache. Bigger headache. Chronic pain clients or today's work?
I think right now.
Oh, come on.
How long was
Back
that?
on the bike.
Holy
I
crap.
actually didn't time it, but we'll figure it out later.
All right.
Okay, I'm going to start this over.
Okay, must.
Start it over. You have 5 cows, you blind person.
It's freaking.
Elbows.
All right, what else?
Best tool in your toolbox besides your hands?
My eyes.
Oh, explain.
I would say from watching, patients gait to how they move. Yeah, huge.
Cool, go faster. Most underrated recovery tip?
Sleep.
Yeah. How many hours of sleep do you need?
Honestly, 6 to 8.
Yes. I'll ask you the next one as you're on the wall. This next one is definitely a toss-up as to what it is. Sit down lower. Nice try. Who's your favorite coach, me or Ryan?
Who made this damn workout?
Me.
Ryan.
You're at 5 seconds.
That's it.
Have you ever faked excitement when someone says, I saw this on Instagram?
Absolutely. The first words are, I found this on Instagram or YouTube. Forget it.
I want to see what your face looks like. 20 seconds.
Oh, that's it. All right, well,
All right.
just wait.
Well, that's the one. There you go. Okay. Have you ever wanted to fire a client who wouldn't follow your PT plan?
Absolutely.
Ooh, did you do it?
No, in my head,
I would so fire you right now, but
in my head, I wrote them a
but I care too much.
Exactly.
What's a rehab trend you wish would just go away?
How to bulletproof your knees.
I hate that term so much.
No.
So much. Okay.
Like-
Have you ever been injured and refused your own advice?
Absolutely. Listen, I don't practice what I preach all the time, right? But
I have to tell people, I'm going to do as I say, not as I do, coach.
Exactly that
Okay,
part.
3 more. You got to hold it just through the loud 3. What's one fitness myth you're tired of busting over and over?
That you could stretch through everything.
Okay. Would you rather do 50 glute bridges or chase down a non-compliant client?
50 bridges.
Okay, now while you're holding this, tell everyone where to find you.
Los Alamitos, 5010 Catella Avenue, Los Alamitos, Hatfield Chiropractic. That's where you'll find me.
Business phone number.
714-485-9496.
Instagram.
Hatfield Chiropractic.
There you go. High five. Elbows.
Hey.
Wait.